Hi, I'm Sam. I'm 31. I've got arthritis. Arthritis is swelling and inflammation of the joints caused by cartilage breakdowns. When I first got diagnosed, I was 18, but the symptoms started when I was about 16. So the symptoms felt like pain quite a lot and swelling of the joints and just abnormalities. Wasn't restricted from doing anything really. It got in the way of my career, so I can't be an electrician anymore. But I just changed my career to something that suited. The main medications that I take is paracetamol and codeine for the pain, and then take naproxen for the swelling and gabapentin sometimes. Now probably about a 2, but it depends on the weather and what I'm doing and everything else. But it can get up to probably about an 8. It stops you from sleeping at night sometimes. So any advice that I give to someone else going through the same thing is use the paths that you've got with the doctors. So go to the clinics that they give. There's a pain clinic and a few other things. Speak to people that have got the same thing to see if they've done anything that helps, and just stay positive. I used the pain tool kit, which is an app on your phone, which the doctors can see. I went to the pain clinic and I went to some like coffee times with other people that have got it as well. My future will look pretty much the same as where it does now. Hopefully, don't let it get in the way. It's going to get worse before it gets better, but you just got to keep going, haven't you?
I'm Sarah Gudgeon. I work for a charity called Arthritis Action. I'm one of the service development managers at the charity, and part of my role is to engage with people and network and spread kind of the good word of Arthritis Action and what we do to help people living with arthritis. The Arthritis Action predominantly helps people to self-manage their arthritis. So that could be through it's self-management, but it's also an holistic approach to managing someone's arthritis. So we help people with exercise and diet. We help people kind of how to speak to their consultants and their GPs and things like that to get the most out of their appointments. And we're also say like a membership organisation as well. It's not the only thing that we do, but we do have a lot of members who join with us, and there are a lot of member benefits to becoming a member with Arthritis Action as well. So we, like I say, we help people to self manage their arthritis, and that is predominantly what we do. Word arthritis actually means inflammation of the joints. That's what it means. Inflammation is quite difficult to imagine or describe, but it's basically part of the body's normal healing process, a little bit like healing a cut or a bruise or something like that. Inflammation is similar to a bruise with swelling inside the joints or more than one joint, and that's what causes the pain, the stiffness that people feel when they're living with arthritis. One kind of cause for arthritis, as there are many different types. There are, in fact, over 200 different types of arthritis, so probably more than you probably than you initially imagined. Where the most common are rheumatoid and osteoarthritis. There are a number of factors that can help one reduce the risk of arthritis. So, for example, osteoarthritis, especially in the kind of the knees and the hip areas, is predominantly more common in people who are overweight, and it causes a lot more pain. Drinking excessive alcohol as well can also trigger an attack of gout, which is another form of arthritis. And we often find that people who smoke, rheumatoid arthritis is more common in people who smoke. So they're just a few factors there. Symptoms of arthritis is pain and stiffness, which can differ hugely from person to person. It can come and go at different times as well. It's not consistent. The pain and stiffness that people feel really depends on the type of arthritis that somebody's living with. For example, osteoarthritis is the body attempting to repair itself. It's often referred to as wear and repair. Oh, sorry, wear and tear. Now referred to as wear and repair. And rheumatoid arthritis is the immune system attacking the joints. So that is different. And another form of arthritis, which I just mentioned, is gout, and that is it's crystals of uric acid which are irritating the joints. So they're three different types. There are thought to be over 20 million people living with some kind of arthritis or musculoskeletal condition. It's the most common cause of disability in the UK, and it can affect people of all ages and not just older people. Many people do associate arthritis with older generations. And a condition that only affects them, but that isn't true at all. Osteoarthritis is more common as we get older. As I said before, it's degenerative arthritis, so it's wear and tear, wear and repair. But rheumatoid arthritis and other forms of inflammatory arthritis can start at any age. Everyone's arthritis is very different and unique to the person who's living with it, which means that there is no one way to manage it that works for everybody. So in this case, one size just doesn't fit all, and unfortunately, there isn't a cure for arthritis yet. But let's hope there is in the future. So healthcare professionals such as GPs can provide support and refer people to different NHS services. So some of these services include rheumatology departments. They generally specialise in inflammation types of arthritis, so like rheumatoid arthritis. MSK departments and services, so that refers to musculoskeletal conditions, which includes arthritis, and it's often including things like bones, muscles, tendons, ligaments, and soft tissue. Dietitians and nutritionalists are also available on the NHS for people to be referred to. IAPT services as well, that stands for Improving Access to Psychological Therapies, and they help people to manage their feelings and their emotions whilst living with a long-term health condition. There are also a number of prescription medications that people can take as well to help manage their pain if it's really bad. And also there are in more severe cases access to surgery and things like that. But as I mentioned earlier, arthritis affects people very, very differently. And individuals, we personally at Arthritis Action, we encourage individuals to find the self management approach and the techniques that help that individual to live a full and active life with their arthritis. Okay, so support. So as I mentioned earlier, Action helps people to self-manage their condition, and we often encourage supported self-management. So that's when self-management is helping yourself, but supported self-management is helping other people to help you as well. So that means allowing others such as family, friends, healthcare professionals, all of those people helping you as well as you helping yourself. So it doesn't have to be a journey that you're on solo. Like, we do encourage other outside help to help you as well. These include things like, keeping to a healthy weight, regular exercise, eating a healthy diet, as well as dealing with sleep problems and stresses that may cause the pain for one in one's arthritis to become worse. Many people believe that exercising can actually damage the joints affected by arthritis, but that's not true at all. Reducing activity levels means the muscles around the joints become weak, which in turn increases pain levels. So therefore, the most important self-management action that we encourage people to improve their arthritis and their pain is to increase their exercise. We definitely don't mean marathon training or anything like that, but it's about increasing little things that you do. So for example, it's probably about walking a little bit longer every day, or doing a little bit more gardening, just keeping yourself active. And over time, all of those exercises and activities will increase your muscle strength, and it will help stabilize the joints that are affected by arthritis, and ultimately improve your pain and function. So that's the main aim of increasing, exercise. It's also acknowledging and dealing with mental health issues as well. So, such as anxiety, low mood, and depression. These are all things that are or can be associated with living with arthritis. To reduce to help reduce pain, it depends where the arthritis is in your body, but to help reduce pain, exercise is one of the things that you can do. Obviously, changing your diet. We often highlight that's a highlight. We often promote the Mediterranean diet. Oily fishes, lots of vegetables, and things like that. There are significant studies to suggest that the Mediterranean diet is one of the best diets to be on if you are living with arthritis. It's also supported by NICE, which is the National Institute of Clinical Excellence, and we follow a lot of their guidelines. So if it's something that they have obviously approved, then we often follow it as well. But there isn't enough kind of research to suggest anything else yet. But the Mediterranean diet is what we promote at Arthritis Action.
So any advice that I'd give to someone else going through the same thing is use the paths that you've got with the doctors. So go to the clinics that they give. There's a pain clinic and a few other things. Speak to people that have got the same thing to see if they've done anything that helps, and just stay positive.